Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Vertebral spine and also as a landmark for the viscera. So starting with the C5. The C5 spine has the vertebral body level at C6. Then the viscera, it includes the cricoid and also the cricoid cartilage as well as the start of the esophagus. Then comes the C7. The C7, the vertebral body is nothing but the C7 to the T1. So the viscera here is nothing but it is a lung apex. Next comes the T3. So T3, the vertebral body is nothing but the upper T4. And the viscera is the aortic, it reaches the vertebral column. So the aorta, if you see, it reaches vertebral column and the medial part, it is of the scapular spine. Next is we look at the T3 and T4. The vertebral body level, it includes the T4 and the T5 disc. And here T4 and the T5 disc. And here the viscera is nothing but the sternal plane. The sternal plane is nothing but the viscera. And also the angle of the Louis. Now we have the T4. The T4, the vertebral body is nothing but the upper part of the T5. So the viscera, it includes the T4. The T4, it includes the concavity of the aortic arch. So aortic arch, concavity, and also the azygous vein into the SVS. Azygous vein into the SVC, and the bifurcation of the pulmonary trunk, and also the upper border of the heart. Then comes the T6, the T6 spine, and the T6, it coincides with the T7. And here the tracheal bifurcation is seen, and the level of the bifurcation of the trachea, it varies from the lower third of the T4, so lower third of T4 and to the middle of the T7, so middle of the T7. So the average position is at the level of the lower third of the T5. Next is the T7, so this coincides with the upper part of the T8. So here it includes the inferior angle of the scapula is present. So T7, the inferior angle of the scapula. Next is the lower border of the heart. And also the IVC crosses the diaphragm. Next is the central tendon of the diaphragm. Then comes the T12 to the L1. So T12 to the L1 space. So here this includes the mid L1. So this coincides with the lower border of the lower level of the pleura. Next comes the pylorus, transpyloric plane. Then comes the hilum of the kidney, the hilum of the left kidney. Next is the origin of the renal arteries and the superior mesenteric artery, the neck of the pancreas, as well as the spinal cord termination. Next we move on to the L1 to the L2. So L1 and the L2 space. So here it coincides with the mid L2, and here it includes the head of the pancreas as well as the duodenojejunal flexure. Then comes the L2, L3. This is nothing but the mid L3. Here it is nothing but the lower border of the kidney. Next is the L3 and the L4. This is nothing but the mid L4. And this coincides with the bifurcation of the aorta. Next is the L4, L5. This coincides with the L5. This is involved with the formation of the IVC. To learn and grow daily like this, please do subscribe.